1 year ago, COVID-19 brought our lives to a standstill. It's been a year of loss and hardship for many Rhode Island families. The food bank and its network of food pantries and meal sites has served thousands of new people who never needed food assistance before, but now can't afford adequate food. We went from serving 53,000 people each month before the pandemic to 68,000 people each month during the pandemic. And to meet that high level of need, we're distributing a lot more food, millions of additional pounds. And we're indebted to the community-based organizations and congregations that kept their food pantries and meal sites open despite the risk of COVID-19. And I just want to take this opportunity to thank all of our community partners for their extraordinary work over the past year, and along with all of the volunteers that make that work possible. In this most difficult of years, our work was complicated at the food bank by the fact that food donations decreased. The food industry and supermarkets have less surplus food to donate to food banks. So to meet the high demand for food assistance, we're purchasing more food than ever before, and that takes money. For 12 years, we petitioned the Rhode Island General Assembly to increase the state grant for the food bank from $175,000 to $350,000, strictly to be able to bring in more food. Fortunately, this year, the governor's proposed budget includes this increase for the food bank. Now it just has to be approved by the General Assembly. So you can help us by calling your state representative and senator and telling them that you support this increase for the food bank. That would be much appreciated. It is our moral duty to ensure that no one in Rhode Island goes hungry. Feeding the hungry is a moral issue. The problem of hunger is a political issue, best addressed by government policies. Hunger rooted in poverty is an economic issue, best addressed by increasing wages, tax credits, and affordable housing. And hunger is a matter of public health. COVID-19 has taught us that racial and ethnic disparities in food security have serious health consequences. During the pandemic, 1 in 4 Rhode Island households was food insecure, but the rate of food insecurity was even higher among Black and Latinx households, 1 in 3. And diet-related conditions that make COVID-19 more dangerous are common among food insecure adults. So if we want to achieve health equity, everyone needs access to nutritious food. And to be able to purchase healthy food in their community. COVID-19 also taught us the essential and unique role of government. In the worst days of the pandemic, massive government assistance was needed to prevent widespread hunger in Rhode Island. Between March and August of last year, low-income families in Rhode Island received $175 million in SNAP benefits and pandemic EBT benefits to be able to purchase food at the supermarket and grocery store. But these nutrition programs were a lifeline for the people who were most harmed by COVID-19. Now, the Biden administration is taking steps to expand these programs and benefits. The American Rescue Plan that the president signed last month extends through September a 15% increase in SNAP benefits. We've been advocating for increased SNAP benefits for years. So it just goes to show advocacy pays off. And sometimes change really does happen, but we can't let up now. Economic recovery from this crisis is going to take time. So we have to insist that our political leaders make a sustained investment in these critical government nutrition programs. Let's use the lessons learned from the last year to create long-term solutions to the problem of hunger. Thank you.